Thanks so much for joining us for day 2 of the Fierce Pharma Marketing Awards as we celebrate the most compelling, influential, and innovative pharma companies and their agencies in the life science industry. Now, during today's session, we're excited to recognize the finalists in the Branded Drug TV category, the Disease Awareness TV category, and the Multicultural Campaign category. So, first up, we have the branded category, which recognizes the most creative and effective TV product advertising that goes beyond the tried and traditional. For the finalists, we have Campbell Ewald on behalf of Bayer for Bayer, This Is Why We Science, and Hill Holiday Health on behalf of Novartis for Cosentyx See Me, Move On Anthem. And the winner is Campbell Ewald and Bayer for Bayer, This Is Why We Science. And here is Ray Cairns from Bayer and Jorge Moya from Sociedad, a part of Campbell Ewald, to tell us a bit about their project. Congratulations, Ray and Jorge.
All right, congratulations to you and your teams. I have a few questions. What inspired this campaign? Was it based on any specific research, patient input, or insights?
First of all, thank you for the award. I mean, we're very proud. We have a terrific team that put this together, and I'm glad to be on here. Look at that. I mean, it's a beautiful award. People know Bayer. You know the name. You trust Bayer. It's a global company, been around 155 years. But what's interesting, the research we have done and conducted over the years is that you know our name. You particularly know our aspirin brand, and so we're known as the aspirin company. But what folks don't know is that we're also a large life science company with significant areas in agriculture as well as healthcare, not just consumer brands, but also pharmaceutical. So we thought this campaign was an opportunity to get the word out to Americans about the value Bayer plays in society.
That's great. So what do people think of the campaign?
Response it's been very significant. We're very pleased with the uptake of it. For people who had understood Bayer before they saw This Is Why We Science campaign, the numbers just shot through the roof. We're really excited at this program. The content of it, the visuals were just absolutely incredible. One of my favorites, there's a scene where you got a couple that's seemingly in their retirement areas. We're talking about heart health, and they're dancing together on the dance floor. It really tears at the heartstrings, as Jorge said. We're really, really proud of it.
Awesome. Well, my last question for you guys is, why does creativity matter in pharma marketing and advertising?
I don't know. Traditionally, pharma has been very conservative when it comes to advertising, and I don't know why. So we really never thought of this as a pharma campaign. This was a campaign about humanity, and which is a lot easier to talk about, and we really found the essence of why we get up to work every day, and it's very rewarding when you're working a campaign like this, because you have the feeling that you're really doing something special for people's lives, that at the end of the day, it's not only that you accomplish a job well done, but also that that the message or the result of what you do is really impacting people in a very positive way. That to me is the beauty of what we did, and I think we sort of set the standards for others to really understand that we're not alone and that we can help together.
And I would just simply to build upon that and add that, when we look at how we communicate as a company, we try and think about how people like to receive their information. How, instead of us preaching to people, having a dialogue, starting a conversation about the importance of science in our lives. And obviously this program was launched prior to COVID. And I think now we've all begun to truly embrace, even more so than we had before. And as I said, 87% of Americans believe science and technology can improve their lives. And so for us, you're absolutely right. This was an emotional opportunity for us to speak directly to Americans about the value of Bayer, why you should continue to trust us and believe in us, and our ability to tell our story. in a way that I think is fairly unique in this industry. So we're very proud of this program. We're very proud of our partners, and we are, once again are honored to receive this award.
Awesome. Thank you guys so much. What a great program, and congratulations again.
Thank you.
All right.
Congratulations to Campbell, Ewald, and Bayer. Now for the Disease Awareness TV category, which awards the innovators educating and informing TV viewers around general disease states and health conditions. The finalists are Emcee on behalf of Sanofi Genzyme for Dreidel Dreidel, Finger Paint on behalf of the Concussion Legacy Foundation for Tackle Can Wait, and McCann Health New York on behalf of Bristol Myers Squibb for Bristol Myers Squibb Breathe. And the winner is Emcee and Sanofi Genzyme for Dreidel Dreidel. And here is Stephen Millerman from Emcee to tell us a bit about their project. Congratulations, Stephen.
Thank you. This is awesome. We're thrilled. Our clients are thrilled with Sanofi Genzyme, and the Emcee team we're just so psyched to get this. So thank you so much. Thank you.
Excellent. So what inspired the campaign? Who is your target audience, and what message did you want them to take away from the work?
Yeah, sure. This was a really, really interesting and a unique dynamic. So I'm not sure if people are aware. So Gaucher disease, which is what the campaign was about, it's a very rare condition. It's a progressive condition, and it's a genetic condition where the symptoms are extremely unpredictable, the very serious complications. But what makes it very, very unique is about 1 in 40,000 people get the condition, and because of those reasons, because it's so rare, most people, if not by far most people, they've never heard of the condition. And so from a disease awareness perspective, this was one of those opportunities to really increase the awareness for our patients. And so I think the rarity of the condition and people not knowing about it was really the main inspiration to get the word out.
Was there a specific message you wanted them to take away for this particular campaign?
Yeah, it's the rarity condition is one thing, but the recognition of signs and symptoms of the condition is the part that we really wanted to hone in on, for people to be able to recognize the symptoms that they have, because the one probably most important aspect of this educational campaign is that a lot of the symptoms that come with Gaucher disease, which are very debilitating symptoms, they mimic many other conditions. And so, people could have a lot of these symptoms, but think they may have something else, or think that they might have already been tested or diagnosed. And so the core message was for people to recognize the symptoms that they had and encourage them to talk to their physician about these symptoms specifically, to make sure that they go out and get tested specifically for Gaucher disease, because again, these symptoms can mimic many other conditions.
Why does creativity matter in pharma marketing and advertising?
It's an interesting question, right? Because in a way, that's the way we break through the clutter, right? And I think ultimately, as a creative media agency and our clients, they want us to break through that clutter and grab people's attention. And ultimately, the goal is to influence behavioral change. When you have so much advertising and so much going on, you have to be unique. And then from an agency perspective, our goal for our clients is to help them break through that clutter and stand apart. And so, when we focus on our kind of the cultural aspect of connecting with people, that is definitely, our main goal is to connect, not just creatively, and certainly, the right message at the right time is a key aspect, but we really strive to add that extra level of creativity through cultural nuances. And when you think about, people that have probably never heard of this condition, the best way to increase the probability for them to take action, for them to learn about the condition, to raise that awareness, is creativity and breaking through. And that emotional connection through someone's culture is just a whole different level of connecting with someone.
Wow. Well, excellent job. Thank you so much for your time, and congratulations again on the award.
Thank you. Really appreciate it. We're thrilled, and got to share this with the team. I may need to go to everyone's home to take a picture, but we'll get it done in a mask.
In a mask.
Exactly.
Great job. Thank you.
Thank you so much. Thank you.
Congratulations to Emcee and Sanofi Genzyme. And finally, for the Multicultural Campaign category, which honors the health campaigns that effectively and creatively reach specific minority audiences. The finalists are Emcee on behalf of Amgen for multiple myeloma, It's On. Eli Lilly and Company for first ever in-language and in-culture pharma social initiative, and Emcee on behalf of Novo Nordisk for Hispanic Mobile UX Evolved. And the winner is Eli Lilly and Company for first ever in-language and in-culture pharma social initiative. And here's Amber Graddick, Lynn Fox, and Ariana Matthews from Eli Lilly and Company to tell us more about their project. Congratulations, Amber, Lynn, and Ariana.
Thank you.
What inspired the campaign? Was it based on any specific research or patient input insights? Who's the target audience, and how do they differ from a general market audience?
Yeah, our team discovered an opportunity to accelerate the awareness conversion via social, as Hispanic patients are eager to find diabetes support through this channel in particular. There are about 61 million Latinos who account for 18% of the US population. And as we developed our Latino initiative, we wanted to make sure that we reached and engaged consumers in the right way, where they were, and in the appropriate culture, with an appropriate and culturally relevant message. So social is actually a really important part of Latinos' life. They stay connected to their family, their heritage. It's a really key, important information vehicle for them. We found out that Latinos need to better understand type 2 diabetes, as it's a silent progressive disease. And we connected those dots and decided to launch the Trulicity Facebook page to help Latino patients and their families understand more about the brand with a very positive and empowering message.
Were you able to pull from industry benchmarking or best practices to make this campaign such a success?
That's a great question. Because this page was the very first branded foreign language social media page in the pharmaceutical space, there really wasn't any benchmarking that we could do within the industry. So we looked outside the pharmaceutical space for benchmarking, and then we soaked up those learning opportunities when they were available. Since we have many other Lilly brands that have two-way communication with patients, we were able to leverage some of those learnings, keeping in mind that Hispanic patients really have different needs and ways in which they like to communicate. We were trailblazers in this space, and even as we reached out to our social platform partners, they really weren't able to offer much information at the time. So the innovative work that we accomplished was a direct result of seeing a need and then listening to our patients. We remained agile in the content and the strategy, and it continued to evolve as we progressed in order to meet the needs of those customers. We're really proud. We're the first to offer such a tailored resource to Spanish-speaking patients and their caregivers in the United States. Being the first Spanish Pharma Facebook page is on its own something we're really proud of, as it demonstrated our innovative approach and our commitment to provide a remarkable experience for all patients. And we've recently taken a look, and to this day, we believe and we're unaware of any competitors who've engaged in a two-way dialogue with the non-English speaking population. So we really look forward to continuing to serve those patients.
What makes this campaign meaningful for you, and how do you see daily impact?
Yeah, so as the community manager for the page, I am personally communicating with our patients and caregivers on a daily basis. And I'm in such a unique position to be able to hear directly from our patients when they share the success that they've had on Trulicity, or when they have a question about their medication, or if they need assistance picking it up from the pharmacy, or they might even have trouble affording their medicine. So I'm the one who has the opportunity to share financial and healthcare resources with them, answer their questions, and encourage them on their diabetes journey, and ensure that we're here to help them. So in my role, there's nothing more rewarding than seeing comments about how our medicines are helping patients every day. Those are the comments I enjoy reading most, and that remind us how important the work that we do is. And to be able to reach our Hispanic and Latino customers who often might feel unheard in their own language and using their own communication style makes it that much more meaningful.
Great. Well, thanks for speaking with us today, and congratulations again.
Thank you.
Congratulations to Eli Lilly and Company. And thank you everyone who tuned in. We'll be back tomorrow at 12:05 p.m. Eastern to announce more award finalists and winners. See you then.